My name is Simon Rogers. I'm going to present one of two short presentations regarding the patient concerns inventory. This first presentation is on the why, what, who, when, where, and how. And the second presentation is really dealing with the results of the PCI thus far, specifically focusing on the recent randomized trial. That is going to be the source of the second presentation, outcomes and randomized trial. So why involve the PCI in clinical care? Well, we all know that having head and neck cancer has a major impact on both patients and their carers. It affects many aspects related to patients' quality of life, particularly the physical and functional domains, emotional and social. There's a huge potential for unmet needs, and it can be extremely challenging to identify these concerns in routine practice. The PCI fits into a mantra of using patient-reported outcomes to help inform, improve, and guide clinical consultations for head and neck cancer patients. What is the patient concerns inventory? It's a condition-specific prompt list, and it's been designed in partnership with patients and professionals. And the focus of the prompt list is to allow patients to raise issues that they wish to discuss during their consultation. And the first paper that we published on the PCI dates back to 2009. And the evidence base behind a prompt list comes from the work on question prompt lists. But the PCI is even simpler than a question prompt list, as it just has items that the patient can choose to discuss in their consultation. The collaboration with patients and carers won a national award in 2010. And this is Barry, our senior physiotherapist at the time, who was very helpful in designing and trialing the PCI at that early stage. Who is the PCI aimed at? It's aimed at new patients. It's aimed at those during follow-up. And there's currently work undergoing to develop a PCI head and neck specifically for when cure is not possible. In terms of the new patients, the PCI, the prompt list, has a slightly different prompt list because there are issues that the patient and carers might wish to talk about at the time of diagnosis that become a little bit more redundant during follow-up. So the examples for this would be the cause of their cancer, what sort of investigations and treatment they might be having, what will I be like afterwards, and what sort of follow-up would be required. And so there is a slight difference between a PCI head and neck at diagnosis, if that is chosen to be used, and the PCI used for follow-up. The follow-up PCI has developed over the years and has 56 items within 4 domains: physical and functional well-being, treatment-related issues, social care and social well-being, and psychological, emotional, and spiritual well-being, with a 57th item being other, where the patient can write in another aspect that they might wish to talk about. 57 items. In its fullest form, the second page gives a list of healthcare professionals who they might wish to talk about issues with as part of that consultation or as an adjunct to that consultation. And of course, some units do not have available all these individuals, and there may well be shared roles with one individual covering various elements of this. When should the PCI be used? Well, it can be used routinely, and we've published on how this can be used as patients come to clinic prior to their consultation, and they can complete the PCI, and then this can be used to inform and enhance their consultation. So it can be used in clinic, it can be used at home, and a paper version could be sent to the patient, or it can be used on a portal, an iCloud, so it can be used anywhere that the patient would wish to use it to inform a consultation and conversation. So face-to-face as well as virtual in the world of the COVID-19 pandemic. I know of a unit who uses it as a whiteboard. They have the list of prompt items on a whiteboard, the patient marks which they wish to talk about. It's used in the consultation, and then the whiteboard is wiped clean and then used for the next patient. Paper versions are available, and in the results section, I'll talk about a large international trial that took place where paper was the main source of its use. It can be used as a device in the clinic, and that's how it's been used in my consultations at Aintree, initially on a tablet and then on an iPad. It's been developed for a patient portal, and of course there's scope to use it on a cloud-based technology. And so since 2007, the PCI has been part of routine clinical care in the clinic at Aintree. What have we found? Well, patients really appreciate this approach, this holistic approach where they can express concerns that they might wish to talk about, but for whatever reason forget or feel reluctant to do so. We've shown that it's feasible in clinical care. I was particularly excited by the two papers that showed how it can be used in the hard to reach patients, the older patient, and those more disadvantaged. And key to that is to have the ability for somebody to help those patients who are not familiar with technology to get access to the iPad and complete the PCI. We've shown that it gives a more focused consultation. It can help optimize the teachable moment, so that consultation, however brief, can be made extremely powerful. For some issues, such as fear of recurrence, we've shown that the multiple opportunities that the routine use of the PCI affords makes it a very powerful intervention. Of course, depending on how the items are discussed and used in the consultation, it allows for the opportunity to signpost to other allied healthcare professionals with specific knowledge and expertise in a particular area. It helps with risk stratification and fulfills the personalized care agenda for cancer patients. With the outcomes that are produced, this provides evidence for driving change, and particularly in our practice, that drove the appointment of an oral rehabilitation specialist and also more emotional support specialist time and clinical psychology. The number of papers are increasing year on year, and also there's various international collaborations. Of course, now we have randomized control level 1 evidence of benefit of using the PCI in the consultation. And finally, the concept of using a prompt list has been developed in other conditions such as burns and stroke and neuro-oncology. So that's the very short presentation on the why, where, what, how, and when. And there's another presentation on the outcomes and randomized trial. Further resources are available through the Handle on Quality of Life website, and also linked to the Faculty of Health and Social Care and Medicine at Edge Hill and the Liverpool Head and Neck Centre in Liverpool University. And although there's the PCI material available on a website link, websites will change and evolve over time. So that link in this slide might become obsolete by the time you listen to this presentation. Thank you so much for your time.